Understanding and preventing 5 common bone diseases. Bones are the foundation of our body and play a vital role in our overall health and well-being. However, as we age, our bones tend to become weaker and more prone to diseases. Bone diseases can range from minor fractures to debilitating conditions that can affect your daily life. As with many health issues, prevention is key. This is why we have created this comprehensive guide to help you understand and prevent 5 common bone diseases. In this one video, we'll cover the major causes, symptoms, and treatment options for osteoporosis, osteoarthritis, rheumatoid arthritis, Paget's disease, and bone cancer. We'll also provide you with some tips on how to improve your bone health and prevent these conditions. So, let's get started on protecting your bones. Please like the video and subscribe the channel. If you subscribe the channel, it motivates me to create more videos like this. 1. Introduction to bone health and the importance of preventing bone diseases. Bone health is often overlooked, but it plays a crucial role in our overall well-being. Our bones provide support, protect vital organs, and allow us to move and carry out daily activities. However, just like any other part of our body, our bones are susceptible to various diseases that can significantly impact our quality of life. In this section, we will delve into the importance of bone health and highlight the significance of preventing bone diseases. Understanding these conditions is the first step towards taking proactive measures to protect our bones and maintain their strength and integrity. Bone diseases can affect individuals of all ages and genders. From osteoporosis, a condition characterized by weakened bones and an increased risk of fractures, to osteoarthritis, which leads to the deterioration of joint cartilage, these diseases can have profound effects on our mobility and overall health. Preventing bone diseases is not only crucial for the elderly but also for younger individuals. By adopting healthy lifestyle habits, such as engaging in regular weight-bearing exercises, consuming a balanced diet rich in calcium and vitamin D, and avoiding smoking and excessive alcohol consumption, we can significantly reduce the risk of developing bone diseases. Moreover, early detection and intervention are vital in managing bone diseases effectively. Regular checkups with healthcare professionals and bone density tests can help identify potential issues early on, allowing for timely intervention and treatment. By prioritizing bone health and understanding the importance of prevention, we can safeguard ourselves against the debilitating effects of bone diseases. In the following sections, we will explore 5 common bone diseases in more detail, providing valuable insights and practical tips on how to mitigate their impact on our lives. Remember, our bones are the foundation of our bodies, and investing in their health is an investment in our overall well-being. Let's embark on this journey to protect our bones and lead a vibrant and active life. 2. Osteoporosis, the silent thief of bone strength. Osteoporosis, often referred to as the silent thief of bone strength, is a common bone disease that affects millions of people around the world. This condition is characterized by a decrease in bone density and quality, making the bones weak and prone to fractures. The alarming aspect of osteoporosis is that it often goes unnoticed until a fracture occurs, earning its reputation as a silent thief. As we age, our bodies naturally undergo a process called bone remodeling, where old bone tissue is replaced by new bone tissue. However, in individuals with osteoporosis, this balance is disrupted, leading to a loss of bone mass and an increased risk of fractures. While it primarily affects older adults, especially women after menopause, osteoporosis can also occur in younger individuals due to various factors such as hormonal imbalances, certain medical conditions, or a sedentary lifestyle. The reason why osteoporosis is often labeled as silent is because it progresses silently without any noticeable symptoms until a fracture happens. This lack of early warning signs makes it crucial for individuals, particularly those at higher risk, to be proactive in understanding and preventing this bone disease. Prevention and early detection play key roles in managing osteoporosis. One of the most effective preventive measures is ensuring an adequate intake of calcium and vitamin D, which are essential for bone health. Regular weight-bearing exercises, such as walking or weightlifting, can also help strengthen bones and improve overall bone density. Furthermore, it's important to be aware of the risk factors associated with osteoporosis. These include a family history of the disease, a personal history of fractures, smoking, excessive alcohol consumption, low body weight, and certain medical conditions and medications. By identifying these risk factors, individuals can take proactive steps to mitigate their impact on bone health. Regular bone density screenings, such as dual energy X-ray absorptiometry (DXA) scans, are crucial in detecting osteoporosis early on. These screenings measure bone mineral density and can help identify individuals who may benefit from preventive measures or treatment options. In conclusion, osteoporosis remains a significant concern for bone health, affecting millions worldwide. Understanding the silent nature of this disease and taking proactive steps towards prevention and early detection can significantly reduce the risk of fractures and preserve bone strength. By incorporating a healthy lifestyle, including proper nutrition, weight-bearing exercises, and regular screenings, individuals can protect their bones and maintain a strong skeletal system for years to come. Causes and risk factors. Understanding the causes and risk factors of bone diseases is essential for taking proactive steps towards prevention and maintaining strong, healthy bones. While some bone diseases have specific causes, others may have multiple contributing factors. Let's delve into the causes and risk factors associated with 5 common bone diseases, shedding light on how to protect and preserve bone health. 1. Osteoporosis. The primary cause of osteoporosis is the gradual loss of bone density and strength, leading to fragile and brittle bones. Risk factors include age, gender, women are more susceptible, hormonal imbalance, such as menopause, low calcium and vitamin D levels, sedentary lifestyle, smoking, excessive alcohol consumption, certain medications, and a family history of osteoporosis. 2. Osteoarthritis. Osteoarthritis occurs when the protective cartilage that cushions the joints gradually wears down. Aging is a significant risk factor for this degenerative joint disease. Other contributing factors include obesity, previous joint injuries, repetitive stress on joints, genetics, and certain metabolic disorders. 3. Rheumatoid arthritis. Unlike osteoarthritis, rheumatoid arthritis is an autoimmune disease that causes chronic inflammation in the joints. The exact cause is unknown, but genetic and environmental factors contribute to its development. Women are more likely to be affected, and smoking is a significant risk factor. 4. Paget's disease. Paget's disease is characterized by abnormal bone breakdown and regrowth, leading to weakened and misshapen bones. The cause is not fully understood, but certain genetic factors may play a role. It is more prevalent in older individuals and those with a family history of the disease. 5. Osteogenesis imperfecta. Osteogenesis imperfecta, also known as brittle bone disease, is a genetic disorder that affects collagen production, resulting in fragile bones that fracture easily. The condition is typically inherited but can also occur due to spontaneous genetic mutations. The severity of symptoms can vary greatly. Understanding these causes and risk factors empowers individuals to take preventive actions. By adopting a healthy lifestyle, including a balanced diet rich in calcium and vitamin D, regular exercise, avoiding smoking and excessive alcohol consumption, and seeking medical advice when necessary, we can reduce the risk and impact of these common bone diseases, ensuring long-lasting bone health and quality of life. Symptoms and complications. Symptoms and complications are crucial aspects to consider when it comes to understanding and preventing common bone diseases. Recognizing the early signs and seeking appropriate medical attention can make a significant difference in managing these conditions effectively. One common bone disease is osteoporosis, which often remains asymptomatic until a fracture occurs. However, some individuals may experience gradual height loss, back pain, or a stooped posture. Fractures in the wrist, hip, or spine can lead to severe pain, limited mobility, and reduced quality of life. Another bone disease, osteoarthritis, typically manifests as joint pain, stiffness, and swelling. Over time, these symptoms can worsen, causing restricted movement and difficulty in performing daily activities. In advanced cases, bone spurs may develop, further contributing to pain and joint deformity. Rheumatoid arthritis, an autoimmune disease that affects the joints, can cause bone erosion and joint deformity. Individuals with this condition often experience joint pain, stiffness, swelling, and fatigue. If left untreated, rheumatoid arthritis can lead to severe joint damage, disability, and systemic complications. Paget's disease of bone is characterized by abnormal bone remodeling, leading to weakened bones and an increased risk of fractures. Common symptoms include bone pain, deformities, hearing loss, and neurological complications. Early detection and appropriate management are crucial to prevent complications and maintain bone health. Lastly, osteogenesis imperfecta, also known as brittle bone disease, is a genetic disorder characterized by fragile bones that fracture easily. In addition to fractures, individuals with this condition may experience skeletal deformities, hearing loss, and dental problems. Regular medical care, physical therapy, and lifestyle modifications can help mitigate the risks associated with this condition. Understanding the symptoms and complications of these common bone diseases is vital for early detection and intervention. By staying vigilant and seeking medical advice, individuals can take proactive steps to prevent or manage these conditions, ensuring optimal bone health and overall well-being. Please like the video and subscribe the channel. If you subscribe the channel, it motivates me to create more videos like this. Prevention and treatment options. Prevention and treatment options play a crucial role in safeguarding the health of your bones. By taking proactive steps, you can reduce the risk of developing common bone diseases and ensure the longevity and strength of your skeletal system. One of the most effective preventive measures is adopting a balanced and nutritious diet. Consuming foods rich in calcium, such as dairy products, leafy greens, and fortified cereals, can contribute to the overall health of your bones. Additionally, vitamin D is essential for calcium absorption, so make sure to include sources like fatty fish, egg yolks, and sunlight exposure in your routine. Engaging in weight-bearing exercises regularly is another key aspect of maintaining bone health. Activities like walking, jogging, dancing, and weightlifting stimulate the bones to become stronger and denser. Remember to consult a healthcare professional or a certified trainer to design a fitness regimen suitable for your age and fitness level. Avoiding unhealthy habits like smoking and excessive alcohol consumption can significantly decrease the risk of bone diseases. Smoking hampers the body's ability to absorb calcium, while excessive alcohol intake weakens bones and increases the likelihood of fractures. Making a conscious effort to quit smoking and limiting alcohol consumption can greatly benefit your bone health. Regular screenings and checkups with your healthcare provider are vital for early detection and prompt treatment of bone diseases. Conditions such as osteoporosis, osteoarthritis, and rheumatoid arthritis can be effectively managed with proper medical guidance. Your healthcare provider can recommend suitable medications, supplements, or therapies to alleviate symptoms and slow down the progression of these diseases. In some cases, hormone replacement therapy, HRT, may be prescribed to individuals experiencing hormonal imbalances that adversely affect bone health, such as in menopause or certain medical conditions. It is important to discuss the potential risks and benefits of HRT with your healthcare provider to make an informed decision. Lastly, maintaining a safe and supportive environment can prevent falls and fractures, particularly in older adults. Removing hazards in your living space, installing handrails on stairs, and using proper footwear can greatly reduce the risk of accidents and injuries. Remember, prevention is always better than cure when it comes to bone diseases. By incorporating these preventive measures and seeking appropriate treatment options, you can safeguard your bone health and enjoy strong and resilient bones throughout your life. 3. Osteoarthritis. Degenerative joint disease affecting bones. Osteoarthritis is a prevalent and debilitating bone disease that affects millions of people worldwide. It is a degenerative joint disease characterized by the breakdown of cartilage in the joints, leading to pain, stiffness, and reduced mobility. While it can affect any joint in the body, it most commonly affects the knees, hips, hands, and spine. The gradual wear and tear of cartilage in the joints is a natural part of aging, but certain factors can increase the risk of developing osteoarthritis. These include obesity, previous joint injuries, repetitive stress on the joints, and genetic predisposition. As osteoarthritis progresses, the cartilage becomes thinner and less able to absorb shock. This leads to the bones rubbing against each other, causing pain, swelling, and inflammation. Over time, the joint may become misaligned, further exacerbating the symptoms and limiting mobility. Preventing osteoarthritis requires a comprehensive approach that focuses on maintaining joint health and reducing risk factors. Regular exercise, especially low-impact activities like walking and swimming, can help strengthen the muscles around the joints and improve flexibility. Maintaining a healthy weight is crucial, as excess weight puts additional stress on the joints, accelerating cartilage degeneration. Protecting your bones from osteoarthritis also involves practicing proper body mechanics and ergonomics. Avoiding repetitive motions or overuse of joints can help prevent excessive wear and tear. Using assistive devices or ergonomic tools can also alleviate stress on the joints and reduce the risk of injury. Additionally, a balanced diet rich in nutrients essential for bone health, such as calcium, vitamin D, and omega-3 fatty acids, is crucial in preventing osteoarthritis. These nutrients help support the maintenance and repair of cartilage, as well as overall bone strength. While osteoarthritis is a chronic condition with no cure, early diagnosis and intervention can significantly slow its progression and manage its symptoms. Seeking medical advice and treatment options, such as physical therapy, pain management techniques, and medication, can help improve quality of life and preserve joint function. By understanding the nature of osteoarthritis and taking proactive steps to protect your bones, you can significantly reduce the risk of developing this degenerative joint disease and enjoy a life with healthy, pain-free joints. Please like the video and subscribe the channel. If you subscribe the channel, it motivates me to create more videos like this. Understanding the causes and contributing factors. Understanding the causes and contributing factors of bone diseases is crucial in taking proactive steps to protect your bones. While each bone disease is unique in its nature and progression, there are common factors that can increase the risk of developing these conditions. 1. Age. One of the primary risk factors for bone diseases is advancing age. As we grow older, our bones naturally become weaker and more susceptible to damage and disease. This is especially true for diseases like osteoporosis, where bone density decreases over time. 2. Hormonal imbalance. Hormonal changes can significantly impact bone health. For instance, women going through menopause experience a decrease in estrogen levels, which can lead to a rapid decline in bone density and increase the risk of osteoporosis. Similarly, hormonal imbalances in men can also contribute to the development of bone diseases. 3. Nutritional deficiencies. A lack of essential nutrients, especially calcium and vitamin D, can weaken bones and make them more prone to diseases. Calcium is essential for maintaining bone strength, while vitamin D helps with calcium absorption. Inadequate intake of these nutrients can hinder the body's ability to build and maintain healthy bones. 4. Sedentary lifestyle. Lack of physical activity and a sedentary lifestyle can negatively impact bone health. Regular weight-bearing exercises, such as walking, jogging, or weightlifting, stimulate bone growth and help maintain bone density. On the other hand, a sedentary lifestyle can lead to bone loss and increase the risk of bone diseases. 5. Genetic factors. Some bone diseases have a genetic component, meaning they can run in families. If you have a family history of certain bone diseases, such as osteogenesis imperfecta or Paget's disease, it is important to be aware of your increased risk and take appropriate preventive measures. By understanding the causes and contributing factors of bone diseases, you can make informed decisions about your lifestyle, diet, and overall bone health. Taking proactive steps, such as adopting a balanced diet, engaging in regular exercise, and getting regular checkups, can significantly reduce the risk of developing bone diseases and help protect your bones for a lifetime. Recognizing the signs and symptoms. Recognizing the signs and symptoms of bone diseases is crucial in order to seek timely medical intervention and prevent further complications. While each bone disease may have its own set of unique symptoms, there are some common signs that can help you identify potential issues with your bones. One of the most prevalent bone diseases is osteoporosis, characterized by weakened and brittle bones. If you notice frequent fractures, especially in the hip, spine, or wrist, it may be an indication of osteoporosis. Additionally, a loss in height, stooped posture, and back pain can also be warning signs. Another common bone disease is osteoarthritis, which affects the joints and leads to degeneration of the cartilage. Symptoms may include joint pain, stiffness, swelling, and limited range of motion. Osteoarthritis commonly affects the knees, hips, and hands. Rheumatoid arthritis, on the other hand, is an autoimmune disease that primarily targets the joints but can also affect other organs. Symptoms of rheumatoid arthritis may include joint pain, swelling, stiffness, fatigue, and general malaise. Unlike osteoarthritis, rheumatoid arthritis often affects multiple joints symmetrically. Paget's disease is a chronic bone disorder characterized by abnormal bone remodeling. This can result in enlarged or misshapen bones, leading to symptoms like bone pain, joint stiffness, and an increased risk of fractures. It can affect any bone in the body but is commonly found in the spine, pelvis, skull, and long bones. Please like the video and subscribe the channel. If you subscribe the channel, it motivates me to create more videos like this. Lastly, osteomyelitis is a bone infection caused by bacteria or fungi. Symptoms may include bone pain, fever, swelling, redness, and warmth over the affected area. In severe cases, there may be difficulty in moving the affected limb and the presence of pus or drainage. It is important to note that these symptoms can vary in severity and may overlap with other conditions. If you experience any persistent or concerning symptoms related to your bones, it is essential to consult with a healthcare professional for a proper diagnosis and appropriate treatment plan. Early recognition and intervention can significantly improve outcomes and help protect your bone health in the long run. Lifestyle changes and treatment options. Lifestyle changes and treatment options play a crucial role in protecting your bones and preventing common bone diseases. By making simple adjustments to your daily routine and taking proactive measures, you can significantly reduce the risk of bone-related conditions. One of the most important lifestyle changes you can make is adopting a healthy diet rich in essential nutrients for bone health. Calcium, vitamin D, and protein are vital in maintaining strong bones. Include dairy products, leafy green vegetables, nuts, seeds, and fortified foods in your diet to ensure an adequate intake of these nutrients. Additionally, limiting alcohol consumption and quitting smoking are essential steps in preserving bone density and overall bone health. Regular exercise is also key to keeping your bones strong and healthy. Weight-bearing exercises such as walking, jogging, dancing, and weightlifting help stimulate bone growth and prevent bone loss. Aim for at least 30 minutes of physical activity most days of the week to reap the benefits for your bones. In some cases, medication may be necessary to treat or manage bone diseases. For example, osteoporosis, a condition characterized by weak and brittle bones, may require prescription medications to improve bone density and reduce the risk of fractures. Consult with your healthcare provider to determine if medication is necessary and to discuss the most suitable treatment options for your specific condition. Aside from lifestyle changes and medical interventions, it's crucial to monitor your bone health through regular checkups and screenings. Bone density tests, such as dual energy X-ray absorptiometry, DXA, scans, can assess your bone strength and help identify any potential issues early on. Remember, prevention is always better than cure. By adopting a bone-healthy lifestyle, remaining vigilant about your bone health, and seeking appropriate treatment when necessary, you can protect your bones and reduce the risk of bone diseases, allowing you to enjoy a strong and active life for years to come. 4. Rheumatoid arthritis, an autoimmune disease affecting bones and joints. Rheumatoid arthritis is a chronic inflammatory disorder that primarily affects the joints. However, it is important to note that this bone disease can also have a significant impact on the overall health of your bones. Unlike osteoarthritis, which is primarily caused by wear and tear on the joints, rheumatoid arthritis is an autoimmune disease. This means that the body's immune system mistakenly attacks its own healthy tissues, including the joints and bones. When left untreated or poorly managed, rheumatoid arthritis can lead to bone loss, joint deformities, and increased susceptibility to fractures. The inflammation caused by this disease can damage the protective cartilage that cushions the joints, resulting in pain, stiffness, and limited mobility. To prevent and manage the impact of rheumatoid arthritis on your bones, early diagnosis and treatment are crucial. Your healthcare provider may recommend a combination of medication, physical therapy, and lifestyle changes to manage the symptoms and slow down the progression of the disease. Additionally, incorporating weight-bearing exercises, such as walking or strength training, can help maintain bone density and strengthen the surrounding muscles. It is also important to adopt a well-balanced diet that includes calcium-rich foods, such as dairy products, leafy greens, and fortified cereals. Calcium plays a vital role in maintaining bone health and preventing osteoporosis, a condition that can be exacerbated by rheumatoid arthritis. Additionally, ensuring an adequate intake of vitamin D is essential, as it helps the body absorb calcium and promotes overall bone health. Regular checkups with your healthcare provider are essential to monitor the progression of rheumatoid arthritis and its impact on your bones. By understanding the disease and implementing preventive measures, you can protect your bones and maintain an active and fulfilling lifestyle despite the challenges posed by rheumatoid arthritis. Understanding the underlying causes. Understanding the underlying causes of common bone diseases is crucial in protecting and preserving the health of your bones. While each bone disease may have its unique set of causes, there are some common factors that contribute to their development. 1. Osteoporosis. Osteoporosis is a condition characterized by the loss of bone mass and deterioration of bone tissue, leading to increased fragility and susceptibility to fractures. The primary cause of osteoporosis is an imbalance between bone formation and bone resorption. As we age, our bodies naturally start to break down old bone tissue faster than new bone is formed, resulting in weakened bones. Hormonal changes, inadequate calcium and vitamin D intake, lack of physical activity, and certain medical conditions can also contribute to the development of osteoporosis. 2. Osteoarthritis. Osteoarthritis is the most common form of arthritis, primarily affecting the joints. It is caused by the breakdown of cartilage, the protective tissue that cushions the ends of bones. Aging, joint injuries, repetitive stress on the joints, obesity, and genetic factors can all contribute to the development of osteoarthritis. 3. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that primarily affects the joints. It occurs when the immune system mistakenly attacks the lining of the joints, causing inflammation and damage. The exact cause of rheumatoid arthritis is unknown, but genetic and environmental factors are believed to play a role in its development. 4. Paget's disease. Paget's disease is a chronic bone disorder characterized by abnormal bone remodeling. The underlying cause of Paget's disease remains unclear, but it is thought to involve a combination of genetic factors and viral infections. It primarily affects older individuals and can lead to bone deformities, fractures, and pain. 5. Osteogenesis imperfecta. Osteogenesis imperfecta, also known as brittle bone disease, is a genetic disorder characterized by fragile bones that break easily. It is caused by a defect in the production of collagen, the protein that provides strength and elasticity to bones. The severity of the condition can vary widely, ranging from mild to severe forms. By understanding the underlying causes of these common bone diseases, you can take proactive steps to prevent their onset or manage their progression. It is essential to maintain a healthy lifestyle, including regular exercise, a balanced diet rich in calcium and vitamin D, and avoiding risk factors such as smoking and excessive alcohol consumption. Additionally, early detection through regular checkups and screenings can help identify potential bone issues and allow for timely intervention and treatment. Early signs and symptoms. Early signs and symptoms play a crucial role in identifying and preventing bone diseases. Recognizing these signs can allow for early intervention and treatment, which can significantly improve the outcome and quality of life for individuals affected by bone diseases. Here are some common early signs and symptoms to be aware of. 1. Persistent pain. One of the most common early signs of bone diseases is persistent or chronic pain in the affected area. This pain may worsen with movement or activity and can be accompanied by tenderness or swelling. 2. Fractures or breaks. Individuals with weakened bones are more prone to fractures and breaks, even from minor incidents or falls. If you notice frequent fractures or an increased susceptibility to bone injuries, it may be an indication of an underlying bone disease. 3. Reduced mobility. As bone diseases progress, individuals may experience a loss of mobility and flexibility. This can manifest as difficulty in performing routine tasks, such as bending, walking, or lifting objects. 4. Changes in posture. Some bone diseases, like osteoporosis, can cause changes in posture over time. These changes may include a hunched or stooped posture, which can lead to additional complications and discomfort.